Yeah, and Bill and Bree, Governor Northam says that he felt that this first weekend of the phase 1 of reopening for most of Virginia went well, and says the reports he got back were that most Virginians were following the social distance guidelines, such as wearing masks in public. And he says, as you mentioned, he is getting to ease the restrictions even further for one Virginia city. Just in time for the Memorial Day long weekend, Governor Ralph Northam announced he'll allow beaches in Virginia Beach to reopen to recreational use this Friday.
This includes sunbathing and swimming, as well as fishing and surfing as defined by the city's ordinance. It does not include group sports, alcohol, speakers.
Currently in phase 1, beaches are closed except for fishing and exercise, but Northam says city leaders came up with a plan to allow more use, with enhanced cleaning procedures and beach ambassadors ensuring compliance. But he issued this warning if people swarm the beaches and ignore the rules.
I will not hesitate to reinstate phase 1 restrictions or even close the beach outright if necessary. My message to Virginians is this, and it's very simple. You must be responsible.
Northam also announced the creation of an education task force that will develop plans for how schools could reopen this fall. He says they'll have to come up with multiple options because of all the unknowns associated with COVID-19.
A lot of these questions could be answered more accurately if we knew how the virus was going to act, what the prevalence is out there, whether it's going to go away this summer, come back this fall. I mean, there's just so many unanswered questions.
Officials also said Monday they've received their largest shipment to date of the antiviral drug remdesivir from the federal government over the weekend. The drug has been shown to help with COVID-19 recovery, and State Health Commissioner Dr. Norm Oliver says they'll use a lottery system to pick which hospitalized patients will get access, but adds more shipments are coming in.
I think over the 6-week period, what will happen is most of those patients will have had a chance to get this medication, if we continue to get it at this level.
And Dr. Oliver says when they finish the selection process for patients with this first batch, they'll be putting out the names of the hospitals that received the drug. Working for you at the state capitol, Cameron Thompson, CBS 6 News.